second of our sessions for our fall mini conference. In addition to myself, my colleagues, Ms. Martha Torshin, we call her Marcy. She's joining us. She's a program coordinator and a specialist for accommodations and accessibilities in our office as well. And also is Miss Emma Sweeney. She is a social work intern joining us this year from the University of Maryland, Baltimore. And also is Miss Angela Samaran. She works in our office as a bilingual parent liaison. Now, if you need interpretation for tonight's presentation, we are making it available in Spanish and in French. You can see the information on your screen, click the globe, and you can access the interpretation room. Tonight's session is being recorded, so if I get a thumbs up from Marcy, I will start the recording. Alrighty.
Already started. You're good.
Perfect. Thank you very much. Now to introduce our speaker for tonight. We are excited to have Dr. Crystal Lewis, who is a licensed clinical psychologist with the National Institute of Mental Health. She has extensive training and experience in pediatric anxiety. This is obviously a popular topic just based upon the number of registrants we had today. She provides evidence-based and culturally informed treatments and preventative interventions to youth and families. Her research interests include self-efficacy and identifying treatment mechanisms of the treatment outcomes with youth. Dr. Lewis is a board certified member with the Anxiety and Depression Association of America, also known as ADAA, and passionate about her research and training in mentoring. And I've stopped my slides so that Dr. Lewis can load up her slides. And in just a moment, we'll be able to hear this very exciting presentation. Dr. Lewis.
Yes, thank you so much for that introduction. Just want to make sure the slides have popped up. They look okay? Okay. Awesome. All right. Thank you so much. I'm excited to be here this evening to talk with you about a topic I am pretty passionate about, but child and adolescent anxiety. I'm going to be taking the perspective of just giving more of an overview about anxiety and what we've been seeing these past few years. And I'll talk a little bit about the work that I do with my institution here at NIH, and then talk a bit about just strategies and tips for parents, caregivers, and all those who are engaged and involved with youth who may have anxiety disorders or comorbid disorders. And so I'll just briefly go over again my background and where I'm coming from. The presentation today is Empowering Families, a Guide to Managing Anxiety. And I am a licensed psychologist working at the National Institutes of Health, which I'll talk a bit about. Slides aren't going forward. Are the slides moving? Mine aren't. Oh, it's a delay. Okay. All right. And so I'll just review here. I don't have any conflicts of interest to disclose. Everything that I'm mentioning today, opinions are my own. If I am talking about any research, it is supported here at the National Institutes of Health. But most of the information that we discussed today, any questions that I'm answering, should not really be considered advice for specific individuals. I'm going to encourage you to talk to your healthcare provider really for advice, or if there are any concerns that you do have about your children or family members. And again, some of the resources that are presented later on in the slides are informational. And so again, they're not comprehensive. They don't really have an endorsement from NIMH. However, we do know a lot of the resources that are presented have been effective for families that we do work with. So I just have to review that. All right. And so here, as for those of you who aren't familiar with the National Institute of Health, we are located in Bethesda, Maryland. That is a picture of our clinical center. Campus is rather large, but the clinical center is where I am housed, where I'm sitting right now in my office, and where we see most of our patients. Um, I've been here for about 8 years. My time with the team has really focused on providing clinical services. So kids who are enrolled in our studies who have clinical anxiety disorders. I provide cognitive behavioral therapy, working directly with the children and with the families. I have a lot of experience in school-based mental health. I'm involved with community trainings where I work with PTAs, school-based trainings, school psychologist trainings. And really, I'm passionate about sharing what I call science-backed strategies for managing mental health symptomatology, for promoting mental wellness, and really just to bring awareness to mental health within the youth community. And with that, as many of you know, is it involves parenting and families. And so although the focus is on children, it's also largely important for us as adults, as parents, caregivers, teachers, school staff to be very aware of our own mental health and how we can manage stress and anxiety so that we can be our best selves and help our kids. So the QR code there is really just so you can learn a little bit more about my role here at NIH. It should link you to the NIH page. And so, as I had a lovely introduction that reviewed kind of my professional background, I always like to include a little bit about just my personal background, my personal identity, because I do believe that this is largely impacting the work that I do. And so, beyond my professional identity as a psychologist, I just also like to share that I do use she, her pronouns. I am a daughter, a cousin, a sister, a mentor. I work a lot with the trainees here at NIH as well as at different institutions across the United States. I am a very proud auntie and godmother. I love to travel, eat, and really just experience all that life has to offer. And so, why this is important is just to note that I do come in with a certain level of expertise in this area of anxiety and mental health in children. However, I am still human, and my personal experiences do influence, I'd say, my outlook and my perspectives to some degree. So, take that as you will. And I mentioned kind of my role here at NIH. So I work with a group that's called the Section on Development and Affective Neuroscience, SDAN. They do like acronyms here at NIH, so you hear a lot of those going around. But essentially, our group is led by a child psychiatrist, Dr. Daniel Pine. And within our group, we primarily use imaging techniques or fMRI to look at brain circuitry in children who do have anxiety and children who do not. And essentially, we're comparing brain circuitry. We're using imaging tools and techniques, behavioral kind of data we're collecting to really explore how we can best help these children who do have high levels of anxiety and stress. We know that brain circuitry plays a major role in fear and reward, and emotions have been linked to several different areas in the brain. And so essentially the work of our group is to really understand how this circuitry relates to overall impairment and recovery from anxiety as well as depression. And so, myself as a clinical scientist or clinical psychologist, really interested in knowing whether having an understanding of these kind of what we call neuromechanisms in the brain, how that can inform our attempts to enhance the treatments that we have for child anxiety and kind of lend to prevention efforts as well. So, my clinical focus is on helping children, adolescents, also young adults, parents manage stress and anxiety. So our team is made up of a variety of different, we'll say, kind of professionals from clinical psychologists to researchers, and then a lot of trainees. So we have those young people who are studying to become medical doctors or PhD doctors and practitioners. And so I mentioned again, our group really just uses the fMRI imaging that's to the left to look at how the brain is functioning. And as part of what we do here, it's not just the research, we provide treatment as well. And so it's kind of a mixed bag of looking at how we can best collect data through our research and help families through the treatment that we provide. So I'm going to talk a little bit today about anxiety in general. What is pediatric anxiety? I'll touch on education about anxiety and how I use that in my sessions with our kids, but also the research we do here. I'll touch on assessment, diagnosis, and treatment, and then talk a bit about strategies for parents and caregivers. So it's a lot of information in a short amount of time. And again, we hope to provide you with these slides for reference. And really, it's just providing a general background to anxiety in our youth, and things that we can do to really identify anxiety and also intervene and provide kids with strategies to manage their anxiety and improve their overall mental health. All right, so to start with anxiety in general, did we go? We went, okay. Anxiety is one of the most common forms of clinical disorders that youth experience. We know that there's a lifetime prevalence of about 32%. And so we can say like 1 in 3 adolescents will experience a clinical anxiety disorder at some point across the lifespan. And we know that kids experienced high levels of anxiety during the pandemic, as well as adults. But even prior to the pandemic, anxiety was on the rise. From 2016 to 2019, there were significant increases in anxiety and stress. There were articles published in, research journals and surveys that were done with college students and young adults, indicating that levels of anxiety as well as depression had been on the rise. So although the pandemic kind of really exacerbated this, we've been seeing these increases for some time now. And so this is where it's really important to be aware of what anxiety looks like in our youth and how we can best intervene and really help them. We know that anxiety can manifest very early on in terms of in young children. Preschoolers can have significant levels of anxiety. And anxiety left untreated often leads to more anxiety in adolescence and early adulthood, comorbid disorders. And so untreated anxiety often then turns into depression in adolescence and later adulthood. And there's a whole host of negative effects that could happen from untreated anxiety, which includes, I mentioned depression, but substance use in adulthood, overall underachievement in school, as well as occupational difficulties, and just a general functional impairment. And so, although many people do live with anxiety, it can really be impactful in these different areas. And so, I highlight that to begin with because it really is the impetus behind why we're studying anxiety. And when we describe it, well, what exactly is anxiety, right? The definition there in the blue box, well, essentially it's a reaction to a perceived threat or stress that's manifested in these different areas of our thinking, how we think, what we feel in our body. So physical feelings of anxiety could be headaches, stomach aches, heart racing. You have the physiological effects and then behaviors. And we see anxiety manifest in behaviors in a variety of different ways, especially in kids. And so I'll touch on that in a minute as well. But essentially, anxiety can become extremely impairing in that it interferes and it doesn't help, but anxiety can really impact an individual in that they're misinterpreting things going on around them. And so there's a high level of threat in the environment and a sense that we won't be able to handle it. So something bad's going to happen and we won't be able to handle it, right? And so again, youth who have experienced negative life events, who really haven't developed certain coping skills, are really more prone to experiencing anxiety. And they're overestimating that these negative things are going to happen around them and underestimating their ability to handle them, right? We call that efficacy. Self-efficacy, that's an area that I'm interested in. And you can really think of it as like confidence in one's ability to handle things. So I'm going to move into, well, what does it look like? Symptoms of anxiety in children. Although this is not an exhaustive list, these are some signs that you might see in kids who are experiencing anxiety. And in younger children, it's more common to see some behavioral manifestations. And so that might look like increased tantrums or emotionality, maybe some aggression towards siblings or other kids or even towards parents. In younger kids, you can see some regressive behaviors. So kids who were maybe potty trained are now having more accidents, or there's just like a lot more baby talk. Oftentimes kids you'll see, they're just very tearful or crying easily. And even for the young kids, especially clingy, like so toddlers. And then as kids get older, you might see some different symptoms that are still related to anxiety in terms of more moodiness or irritability, withdrawal or isolation, and really just kind of like, we'll say, not interested in things, right? Everything becomes boring or just like, yeah, I don't want to do anything. And so symptoms in kids can be worries. So they'll express worries about a lot of different things. It could be academic worries in the school environment, not doing well, not being able to learn certain things, worries that the teacher is going to be mad at them, they won't have friends. There can be avoidance behaviors. So kids are saying they don't want to go to school, they don't want to do things with friends. Oftentimes, kids might have difficulty separating from their parents or caregivers. They get very scared if they have to do anything independently. And then I already mentioned some of these other ones, right? And so kids could be moody or aggressive, more tantrums. You might see changes in how kids are eating or sleeping. And so their appetite, they might have less of an appetite, have difficulty falling asleep at night or staying asleep at night, or nightmares, and difficulties with learning. And so here's an educational context or arena where it gets a little difficult to really figure out, okay, for a child who is having troubles in the classroom, learning content, kind of getting work done, how much of that might be fueled by anxiety and how much of the difficulties learning then increases anxiety, right? So it can go either way. And we do see a fair amount of anxiety in school, in different academic environments. And so, as a psychologist, in terms of diagnosing, so everyone says anxiety is normative. Everyone has anxiety at some point in time, right? Um, when should we be concerned? And so, because anxiety is pretty common, and especially at transitional phases for kids, and so maybe starting kindergarten, going into middle school, starting a new sport, making new friends, there are certain points in time where we will see kids more anxious or stressed. But when we're differentiating between, we'll say, normative anxiety and maybe disordered functioning, what do we look at? And so these 4 areas are highlighted: avoidance, interference, distress, and persistence. And we look at, does the anxiety occur when there are situations that it's kind of uncalled for? Can it be explained or reasoned away? Is there a reason why this child is scared right now? And it doesn't make sense, right? Is it unchanged? Does anxiety stay there over time and it does not decrease? We expect peaks in anxiety, but then it might decrease as a kid is habituating or getting used to a situation. So an example of this might be, again, the beginning of the school year. You might see your child more anxious or nervous to go to school, to take the bus. But as time goes on, day by day, right, it should be getting a little bit easier as they're getting used to the situation. But if the anxiety is unchanged and it's just at a high level each time, despite the exposures, that's when we look at, oh, we might want to be a little concerned about this. What's happening? Does the fear or anxiety lead to avoidance of the situation? Are they trying to stay home, not go to school, hiding in their room, taking their really long time to get dressed in the morning? Are there avoidance behaviors? Is the fear or anxiety appropriate for the age or stage? We'll consider. Does it interfere with the child's functioning? So these are all questions that we might ask when we're looking at diagnostically, right? Is this a clinical anxiety disorder? Is the child avoiding things that are of importance and that the child should be doing developmentally at that age? Is there interference? How much is it interfering with the family functioning or the child being able to go to sports practice, complete their homework? Does the child get upset? How distressing is this for the child? Do we see a lot of tears? Do we see a lot of arguing, moodiness? Do we note that it is impacting them? And then persistence. Again, is the anxiety there? Is it unchanged? Is it constantly coming up in certain situations? So we look at all of this together to determine at what point we may say perhaps this child needs an assessment to determine if they have a clinical diagnosis of anxiety. Do we intervene at this point? How can we intervene? So this is just important to understand kind of the process going through here. And I think I'll talk a little bit about the assessment piece, but again, it's important that you talk to your pediatrician or a mental health provider if you do have some concerns about your child having significant anxiety. So this slide really just highlights some risk factors to look at. It's sometimes important because it helps to determine the best form of treatment. We know that cognitive behavioral therapy is effective for about 60% of kids. However, those with a predisposition to anxiety may require some medication, and it's helpful to know, is there a family history of anxiety, right? Has the parent taken some medication? And we know that parents with anxiety might parent in a different way. So the anxiety might impact their parenting strategies. And so we look at all these different risk factors, one being genetics. So like I mentioned, is there family history of anxiety? We look at child temperament. You're looking at how emotional kids are, their anger, irritability, inhibition. Does that put them at a risk for later anxiety? We know some of the research suggests that it does. Parenting and family dynamics, as I mentioned, some parents who maybe more anxious might be a little more overprotective, right? So the way that they're reacting to their children then influences anxiety expression in kids. Or if the family has been exposed to a negative life event, right? Or there's a safety issue, whether it's in the house or in the community, that's going to alter how parents are engaging with their kids and putting their kids more at risk for later anxiety. Stressors, traumatic life events, similar to negative life events, right? That can impact how the family's functioning, how parents are parenting, and how the child is perceiving the world. If they've had an early trauma or an early negative life event, I mean, even if it's a negative experience with a peer. So in first grade, there was some bullying that occurred at school. That then might influence how the child looks at other kids and friendships later on. And then they might end up being more anxious that kids are going to be mean to them and they're looking out for danger and threat, which then can be an early sign of later kind of social anxiety. So it really just depends. We look at these things. And then the last one is parent psychopathology, which all that means is, does the parent have an anxiety disorder or depression or any other disorders that might impact how they're parenting, especially if it's untreated, or maybe just unknown to the parent. And so we try to get this background to understand, what are the risk factors for kids? Is there something we can do to intervene earlier on, or just being aware of it? So I'm going to move into the neurobiological basis of anxiety. And this is important because we look at stress anxiety in the brain. A lot of what my team does is highlight different parts of the brain, which we know to be related to anxiety. And how is that helpful? It's just, some people enjoy having this knowledge of what's going on in the brain. For our kids, we'll talk about what's happening in their brains. So when they do the MRI, we get pictures. They get like a token picture of the brain, which they generally think is pretty cool. And we'll talk about, well, what's going on in our brains, right? Why we have anxiety? How is it normalized? Anxiety is normal. When does it become problematic? And so we'll talk a little bit about the stress response in the body. And what we know is that the stress response begins in specific areas of the brain. So essentially, when threat is detected, when we detect threat in our environment, it could be through something we see, something we hear, past experience we've had, maybe the smell of smoke. It could be triggered by all types of things. The amygdala then sends a distress signal to the hypothalamus, which is like the command center, right? The hypothalamus communicates with the rest of the body through the nervous system. And then we know that once the fight, flight, or freeze system is activated, it affects our ability to access the prefrontal cortex, which is the area that helps us with attention, concentration, decision making. So when that stress response is activated, we have difficulties with our kind of thinking through and our judgment, because we're in a state of fight or flight, which most people have heard of that before. And we know that chronic activation of this mechanism can impair health over time. So if we're constantly on edge and on alert and the stress response is constantly going off, our cortisol levels are high. We know this has implications later on in life for medical disorders. And so this is really where it's important to identify how often this system is activated in a parent, in an adult, and how we can regulate that, and then helping kids to understand when that's happening, if that's happening for them, and ways that they can intervene. So generally, I'll give some examples to the kids about, I have many examples of when my system's activated, and it'll be why that happens and then what we can do. And so we describe it in a way where essentially it could be a false activation, like it's important to have this system because it helps to keep us safe. However, for some people, it goes off too often, like an alarm at school, a fire alarm. And so we'll just talk them through, and we have a lot of fun handouts, pictures of the brain. And so this next slide really just highlights again this brain circuit, the brain circuitry that we look at. And we do know, like I mentioned, anxiety is adaptive, so we never want to present it in a way where it's bad, right? It's just something that can help us, but often it can get in the way if it's activated too often. And so, through the research that we've done and years of research, they've identified the fear circuitry in our brain, which helps to keep us safe. And so, essentially, this is the limbic system. You see the highlighted parts of the brain there. There are many different parts of the brain involved, but we focus specifically on the amygdala, the limbic system. And what we know is that there are differences in this activation in the brain in individuals who have clinical anxiety versus those who don't have clinical anxiety. And so we'll talk about those false activations, right? So the system is activated more frequently in those who have high levels of anxiety versus those who don't. And so why this is important is say essentially when that system's activated, right? The thinking part of the brain, like I mentioned, the prefrontal cortex, usually is able to down regulate the amygdala, but that capacity is weakened in those people, children and adults who do have anxiety. And so again, we look at, well, if that's happening, right, what can we do? How do we intervene? Um, so here I talked about this already, but the fight or flight response, right? What's happening in our body when it's activated. And there's research that looks at, well, we think that there are two different circuits, I think, that are activated. And one essentially is just when that amygdala goes off and the hypothalamus is activated, right? The physiological responses we have, our heart's racing, our body's getting into that fight or flight mode, it's getting ready to protect us. There are behavioral and physiological responses as well. So all of this, we don't get down to that level of detail when we're talking with the kids. But again, it's important to understand our brains and our bodies and what's happening when we are anxious. A lot of times adults don't even realize like what's occurring in their body is anxiety. We might interpret it as, my heart keeps racing. My chest hurts. I think it's a medical condition, right? Let me go to the ER. Let me go to urgent care. And oftentimes this could be an anxiety response, but we're not fully aware of what's happening in our body. And so we do talk about this a bit. This slide here is just highlighting some of the research that supports this, what we call hyperactivation, but this activation in the brain for youth who do have anxiety, again, highlighting those same parts of the brain. The exciting part here is that treatment has been shown to normalize parts of the brain. So for those who aren't aware of our group or NIH, we've had, I think it was earlier this year, a recent publication that came out that highlighted changes in the brain after cognitive behavioral therapy. So this is super exciting because one, it just shows the plasticity in the brain that things can change over time and that we're able to intervene in ways that often we think, well, we need medication or we need something more powerful than just our exposure therapy or talk therapy. But what we found is that through exposure therapy, we are able to change parts of the brain and reduce anxiety over time. And so that's the exciting part. All right. So I'm going to talk a little bit about assessment, diagnosis, and treatment here. All right. So essentially, we have specific ways of diagnosing anxiety. I know, especially now, a lot of our teens will come to us and say, I have anxiety. I took this quiz on TikTok or I found this. And there are general screeners or self-reports online to determine whether you might have symptoms of anxiety. But really, it's important to get full assessments by a professional, by a mental health provider, because oftentimes you may have to differentiate between anxiety disorders and comorbid disorders like attention deficit hyperactivity disorder, autism, specific phobias. There are different types of anxiety. And so even though you might think, well, my child's very scared in social situations. They seem to try to avoid peers. They don't talk to adults. And so it's like, I think they have social anxiety. That may be the case. And so it's important to collaborate with your pediatrician, your primary care provider who says, okay, well, let's have them get evaluated. And getting a comprehensive evaluation can then help determine, are there other things that are happening, other skill sets that they need to develop that might be related to the anxiety. So here, this just lists some free self-reports that you can find online. But the gold standard for the assessments that we use here in our clinic and some other clinics you'll hear called the Anxiety Disorders Interview Schedule, the ADAS, the Kitty Schedule for Affective Disorders. These are what's called semi-structured interviews, meaning information is gathered from the parent and the child, and then the clinician uses their judgment to put together a full picture of whether This is anxiety, depression, or some other comorbid disorder. They do take a long while, and so oftentimes pediatricians aren't using these, they're using screeners. But once you are connected with a psychologist, a licensed social worker, someone who is doing mental health, a mental health professional, then they can help kind of solidify that diagnosis, which is important so we know how to best intervene. This slide here is highlighting the anxiety disorders. And so for the most part, what we use is the Diagnostic and Statistical Manual. That is our basis for diagnosing anxiety disorders. These are the most common. You'll see generalized anxiety, social anxiety, separation, specific phobias, panic, agoraphobia, selective mutism. A lot of times I'll have individuals who will say, well, what about OCD? That's not listed, or PTSD. Although in the past those have been in the same category, now within this new manual, OCD, PTSD are in a different part of the manual. However, you will often see obsessive compulsive disorder along with generalized anxiety disorder. And so you can sometimes see that comorbidity between the two. But for our group, we focus on generalized anxiety, social anxiety, and separation anxiety. And so if our kids have a primary diagnosis of any of those, they can be enrolled in our study. And then we often see comorbid disorders, and that might be a specific phobia. So for the purposes of today's presentation, I'm not going to go through each of the anxiety disorders, but they do vary a little bit in terms of presentation, symptomatology, and what the focus is. And it's kind of in the title, so we'll say generalized anxiety is really classified. Those are our kids who are our little worriers, or it's just what if this or what if that? And it could be focused on doing poorly in school. It could be social worries. It could be performance, but generally they're the worriers. Social anxiety is going to be specific to social interactions. Separation anxiety is generally separation from a caregiver, a parent, or a loved one. Specific phobias can be across the board. It could be of the dark. We get a lot of dogs or animals, heights. Panic disorder is more focused on the physiological symptoms of anxiety. And so those, when you're in a panic state of maybe difficulty breathing, your heart's racing. Panic disorder essentially is the fear of death, the fear of dying, and the fear of having a panic attack. Agoraphobia, difficulty leaving the house, going places where there are a lot of people, riding in public transportation. And then selective mutism, which sometimes is tied to social anxiety or oppositional defiant disorder, which is another type of disorder. But selective mutism is when a child will only speak in certain contexts or to certain people, right? So it might be their complete chatterbox at home, but then at school, they're not saying a word, or they're only speaking to one person or only whispering. So we do get a range of disorders. Again, these can all manifest in children, in childhood and early on. This is where it's important to just know the signs and see how we can intervene and provide kids with skills that essentially will be useful across the lifespan, but could prevent later anxiety or comorbid disorders. So in terms of comorbidity, like I mentioned, often these disorders do co-occur with other disorders. And comorbidity presents challenges, I'll say, in diagnosis and treatment and management, because the presence of one condition can influence the course and prognosis of another. And so for a child who maybe has, let's say for school, we see a lot of ADHD, right? Having a comorbid anxiety disorder can exacerbate the ADHD and vice versa. So it's important to know kind of what is happening. When you think about depression, depression is more mood-based. Essentially, it's a persistent feeling of being down or blah. Kids will just meh, they'll talk about feeling, it's not always just sadness, but emptiness. That can be comorbid with other disorders, right? And so that's going to look very different than a child who does have anxiety. And so getting this full comprehensive assessment is important so that we can then determine, is there any anxiety and depression? Is it just depression? Our treatments are different. And so also here's why it's important to try to talk through with a pediatrician or a licensed professional to see what is happening in your kids. I think that's all I'm going to talk about there, but all right. And so when we look at a child who does have some sort of disability, it can make it more difficult to understand what's happening around them. And so it's important to highlight that. Kids might be bullied due to said disability, whatever it is, or if they have a kind of, a mental health disorder as well. Their disability can affect their daily life, and they often feel like they might be different from other children, or they just don't fit in, or no one understands them. And so over time, it's important that they figure out how to cope with their disability, right? And see it more as a strength. What strengths do they have, and how can they present that? And so again, it's really important to not overlook some of these things that are going on with our kids, but really how we can pinpoint and put a name to everything that's happening with the child and how we can help them get through it. And so it's really about decreasing what we call kind of the stigma around it and really empowering kids. So here we talk a lot to parents and caregivers, teachers as well, but really if you notice signs in a child at school, if you notice some sort of symptoms, again, it's important to get the parents involved and encourage each of the parents and caregivers to help kids to talk through what their experience is, help them to identify the emotion. What are they feeling? When does it happen? Validate their feelings. It is normal to feel sad sometimes about X, Y, and Z. It is normal to feel nervous. You're starting a new sport, right? And letting them know some anxiety is developmentally appropriate, some anxiety, right? We're going to feel, and that's fine. But if it's happening too much and makes us feel bad too much of the time, man, there are things that we could do to help. So parents can use self-help books. There's plenty of validated, I'll say, or science-backed books now that you can buy online that provide basic education and basic skills for mental health disorders. As parents, if you're struggling with something similar or had struggled with something similar, you can model appropriate coping skills and talk through with your child. And I keep mentioning this, but reaching out to the pediatrician or a licensed mental health professional is really helpful just to get the ball rolling and provide the kids with skills to even if you catch it before it is actually that interfering. So therapy is super helpful at different points in time, and so it's important to be open to that. Happen. Oh, yeah, this here is just early intervention is key. The younger we can identify these things, the better. Some of my early on work was in kindergarten classrooms, teaching them which CBT skills, where some people say, oh, kids that young can't engage in cognitive behavioral therapy. They don't have the verbal, knowledge to be able to know what's going on with them. But there are ways to make cognitive behavioral therapy kind of play-based and understandable for kids as young as 3 and 4, and teaching them skills that can help them to just regulate their own emotions, I think is linked to prevention later on. All right, so in terms of treatment options, I'm going to focus a little bit on how we help here at NIH. There are many different ways to intervene, but essentially we know that we have some treatments that are effective, right? We need better treatments that are effective for more kids, but we have basically some great options that have a significant evidence base. So psychotherapy and medications. As I keep mentioning, there's been a lot of research around CBT. Again, not with all individuals, but with enough where we know that specific strategies for CBT are effective. And then also the research indicating that the most effective treatment for moderate to severe anxiety is medication along with therapy. So we know that there are specific SSRIs that do help with anxiety, and we do that as well here. And so my perspective is always starting with 12 to 16 weeks of therapy, cognitive behavioral therapy and exposure work, and looking at how helpful that is for kids, how much they can engage in that type of therapy. Are they learning strategies? Is it helpful? And then sometimes some kids aren't able to engage and do the practices and to do some of the things that we do in session. So we might need medication to help them so that they are able to engage appropriately in session. So it really just depends. As far as our treatment, so you heard me mentioning the cognitive behavioral therapy over and over again. This is pretty well known, I'll say, at this point in time. Cognitive behavioral therapy is a science-backed, evidence-based treatment for people who have varying forms of psychopathology, including anxiety and depression. And the research we have shows that it is the most effective, but it's also the most studied, right, treatment. I might mention a little bit on some other strategies or treatments that we use, but essentially it's focusing on the unhelpful thoughts that we have or our unhelpful beliefs, and how that affects how we are feeling physically, our physical symptoms, but also our emotion. and then how that impacts our behaviors. So we teach the kids about this triangle. I'm going to talk a little bit more about it, and how we highlight unhelpful thinking in session and change avoidance behaviors. Common CBT components. So if a lot of times parents will come to me and say, well, we've already participated in CBT, my child's already done this. And then I'll ask, well, what did it entail? Oh, well, I don't really know. That the child would just go to therapy and play with the therapist. I didn't really know what was going on. And I'll ask, was there any homework given? Well, no. Were they practicing anything outside of session? Was there any practice session? And if the answer to that is no, no, and no, that's not CBT. And so regardless of the manual, the book that you're using, CBT has these core components. It'll be psychoeducation, learning about the symptoms that a child's experiencing. And that's where I talked a little bit about how we'll teach them about the brain and what's going on in their body. And I'll show you a slide on that. Sometimes we'll teach some relaxation or grounding tools. And so that's essentially if you're having physiological symptoms or you're getting too activated to engage in the session, then you need some tools to help you relax. So we might teach those. Tracking thoughts, paying attention to what you're thinking, and then how that's impacting you. And then we'll teach how to restructure thoughts or just think in different or more helpful ways. Exposure methods is the big thing here. So exposure therapy is putting the child in the situation that they're fearing and helping them to see that they can handle it and building their overall efficacy. And then relapse prevention is just like preparing people for the point when it's going to happen again. So you might feel anxious in the future. You might go into a depressive state. You might feel this and that. What do we do? How do we prevent that? And if we can't, then when we are in those states, how do we help ourselves to come out quicker? So again, that's the basic premise behind CBT. So in our sessions here, what we do, we provide 12 sessions of CBT, with the first 3 being just kind of building rapport with the child. CBT is, or exposure therapy is a lot for kids, and there is a level of trust that's required. And so we'll do games, we'll get to know the child. We provide the psychoed about CBT, and what that looks like is we'll go over the cognitive triangle. So thoughts, feelings, behaviors, teach them how that interacts. We talk a bit about the brain and what the brain scans that we do, what we're looking at. And like I mentioned, we might then teach some relaxation skills or grounding tools.
Pardon
And
me,
then
Dr. Lewis.
yes.
We need to appeal to you to slow the pace of
Oh,
sharing.
okay.
And I think this slide is so important. So if you could kind of re-summarize it at a
Sure.
slower pace, that would be great, please.
Okay, of course. Yeah, so this slide highlights the work that we do before we start the exposure therapy with kids. And so the first few sessions of cognitive behavioral therapy are focused on developing a relationship with the child. And so doing exposure work is very intensive and requires a certain level of trust with kids. And even if you're doing this in the school environment, it's important that kids understand what we're doing. And so we'll build rapport with the child. We'll provide some psychoeducation about anxiety in the brain. So we'll utilize this image here, which highlights how our thoughts, feelings, and behaviors are all related. So we'll teach that to the child to help them understand. We'll give examples. We'll talk to them about their brain and their bodies and what happens when they're feeling nervous and anxious. And so what parts of the brain are involved. We'll show them pictures. And here at NIH, they often do the imaging. So we'll have pictures of their brain. And so we can talk to them about that. And then we also teach some skills to help them relax themselves when they are getting nervous and anxious, so that they can refer to that if they're feeling too upset in session. And so these are all done within the first 3, I'd say 3 or 4 sessions before we get into the exposure therapy. So an important part of exposure therapy is going to be, of CBT, is going to be the exposures. And I say the behavioral part of CBT should be exposure work or practicing, facing fears, actively doing things that make the child feel uncomfortable. It's very common that our first instinct is to allow a child to avoid or to get the child out of anxiety-provoking situations. But in session, what we're doing is flipping that, and we're putting them in situations that make them feel uncomfortable and anxious so that they learn how to tolerate that feeling and learn how to manage the anxiety. And so what we know is that over time, the brain learns new associations between what's feared and the response. So the more that we're in a situation, we learn that what we think is going to happen is likely not going to happen. But even if it does, we can handle it. So we teach kids to face their fears. And the way that we do this, I'll talk a little bit on the next slide about using fear ladders or exposure ladders, small steps, and we break down our practices into very small steps. And so oftentimes we might model the behavior first. So if it is a fear of talking to new kids at school, in session, we'll practice what's the first thing we would do, right? Say hi. And so it might be if we have a new person in our session, we would kind of model that. I will say hi to the person. I will introduce myself. And then we'll have the child do it. And so it's a very structured way of practicing and doing what we call the exposure part of therapy. And so here is a image of the fear ladder that we might use. It's an avoidance hierarchy. And we're breaking that fear down, which I'll show an example on the next slide, but step by step, how can we move our way up the ladder to the ultimate goal, whatever that is for each child? And again, in doing this work, it is important that we pick things on the ladder that are going to be realistic, that the child's going to be able to achieve. Start slowly and have the child pick what they want to work on as well. So have them involved in terms of making their ladder. And sometimes we might need to use rewards to help motivate the child to want to practice to do these things because they are hard and they are scary. So this slide here is going to, there we go, highlight a sample fear hierarchy. And so this is a real hierarchy that was used with someone who had a fear of just new people or strangers. And so we broke down their hierarchy into where are we going to start. So the kids come to our session each week, probably once a week. There are nurses in a clinic that take their vitals before they meet with us. So this person, they wanted to start with saying hi to a nurse. So usually they wouldn't respond or they would look down. They'd just be very uncomfortable, even when the nurse was talking to them. So their goal was to start with just saying hi to a nurse. Then we worked on waving to someone in the hallway. So the numbers on the right side highlight how nervous the child was to do this behavior. And you notice that they increase, right? The level of difficulty increases. So we're going to start with something that only makes them a little nervous at a 3 or a 4, right? Then we move our way up to doing more difficult things. And so eventually we have them ordering something. We have a Starbucks on campus, right? Go to the store, order something, change their order, do things that they find that would be challenging for them. And for this person, you'll see there, it's discussing a topic in front of a group of new people. And so we can have 3 or 4 people they don't know come join our session, and then they're going to talk about something or give a presentation. And so for this child, that was the top of their fear ladder. And so we work up to that. We do all these different practices. And so this essentially highlights what exposure therapy is, the behavioral part of CBT for anxiety disorders. Why this is important? So exposures lead to increased confidence, okay? Oftentimes, parents will protect their kids from being in situations that are scary. And so on one hand, that is great so that the child does not have to endure maybe some of the negative things that a parent may have experienced, right? But then what that's doing is teaching the child that they need to be protected. They can't handle tough things. And so what we know is that the theory behind exposure therapy is what's called self-efficacy, but building competence. So if the kids have mastery experiences, they're able to fail at things and then learn how to do it, right? So they fail at doing something, but they try again. They fail at something, they try again. Once they finally get it, they're mastering whatever that is. These mastery experiences lead to increased confidence and willingness that the child's going to try something a little bit harder. These are some quotes from some of my kids. They'll say, well, this is hard, but I can do it. And so as we're going through their fear ladder, I pull out what was one of the thoughts that they said. I was like, oh, well, this is hard, but I can do it. All right, we're going to focus on that. This is hard, but I can do it. This is hard, but I can do it. And I'll reinforce that with them. For some other kids, they may not have anything. So it's kind of like, I'll tell them, feeling scared, do it anyway. Feeling scared, do it anyway. We have one, anxiety won't hurt me. A lot of times kids fear the feeling of nervousness and anxiety because they think that it's bad and it will hurt them. But it's teaching them anxiety won't hurt you. So even though it's there, it's just anxiety. We're going to push through it. We're going to let it sit there. We're going to let it do what it needs to do, but it can't hurt you. And then I know I can handle this. That's that efficacy confidence piece. Like, no matter what happens, I can handle this. A lot of times we work with kids who have some fears about not doing well in school, failing a test, not learning something. And so we say, I know that I can handle this. Even if I don't do that well, I can handle it, right? I can try harder next time. Even if I studied hard and I didn't get the grade that I wanted, it's okay. I can handle it. I'll be disappointed. I'll be sad, but it's not the end of the world. So we're just giving them these different thought patterns, these different ways that they can cope with the anxiety in the moment. So when we're moving into just strategies in general for parents, I highlight it's also for kind of caregivers, people working with kids. But what can we do and how do we help our kids when we do notice signs of anxiety? What should we be doing? When we think about, well, what might cause your child anxiety? These are things to consider. So do they start to get upset when there are unexpected changes in routine? So maybe there's something they expected to happen, and now something else is going to occur, or they're unable to go someplace. Kids can often get very upset at that. Social situations. So being in novel social situations with kids that they don't know, or having to be around maybe mom's friends that they haven't met, that can make them uncomfortable. Lack of stimulation or overstimulation. Some kids feel anxious when there's not enough going on around them. Sometimes they feel anxious when there's too much going on around them, right? And so often we might miss these little cues and think maybe a child's just misbehaving, or now they're just running around the classroom, they're not listening, but it could be that they're overstimulated or understimulated. Something's happening there in that moment. This should be an unbalanced schedule. And so often we see kids who are booked hour after hour after hour. So they have school, then they have an activity, then they have homework, then they have an activity, and it's just a lot. Sometimes that can feed into anxiety in kids. Same way that having not enough scheduled can increase anxiety. Worries can cause a lot of anxiety. And so you say, is that the same thing? Well, worrying is more of just kind of the thought pattern of, well, what if this happens? What if I don't do well with that? Having a lot of worries can then increase physiological anxiety. And it could be about anything, an activity, event, or object. Changes in the environment can cause anxiety as well. A little bit similar to kind of unexpected changes in routine, but environment changing. Sensing anxiety in others. So some kids are very perceptive, and some kids really pick up on the energy around them. So to have an anxious parent, an anxious peer, sibling might cause some anxiety in a child. Inability to complete a required or desired task. So when kids think that they can't do something, oftentimes then that might cause a big reaction. And for us, again, if we're not fully aware, it might look like maybe oppositionality because the child's refusing to do a worksheet in the classroom. And we don't quite understand what's happening. But if they have the thought pattern that they can't do it, this is too hard, and now, okay, I'm just going to be disruptive, sometimes that might be anxiety. And so it's important to really get a good sense of what's happening in the classroom, at home, when we're doing homework. And so when we talk about kids with anxiety, right, how do we help? So it's important, and I mentioned this before, to help the child verbalize their experience. So we want them to encourage emotion language. And so rather than just focusing on, I'm frustrated, I'm irritated, I don't want to do this, right? Let's get to, well, why? What's happening right now? Well, I'm feeling nervous. I can't do this, right? I don't think I could learn this. And so it's okay to put the name to the emotion. What is the emotion? Let's name it and talk it through. And a lot of times it's important that you can model this, not important, you can model this and they can learn to do it when they see their parents doing it at home. Teaching them that it's okay to make mistakes, right? And that we don't expect perfection, and perfection is not a thing. And again, it's not just telling your child this, it's really showing them. And so they understand, because a lot of times parents may say, you know, you don't have to be perfect, it's okay. But behaviorally, they're giving a different message, right? Focusing on the positives. I mentioned before, individuals who do have anxiety, especially clinical levels, are amazing at detecting threat in the environment and negative and possible, negative things, right? So these individuals might appear to be more critical because they're pointing out flaws and mistakes and they're pinpointing all of these things. So for a child who might be prone to do that, it's important to focus on, oh, well, what was good that happened today, right? So they come home and tell you, oh, we had a math test and I got 4 wrong, and they're super upset. Okay, maybe that was upsetting for them, right? But I'm sure there were 6 other periods during the day. What else happened, right? What was good about today? What did you enjoy? So really just balancing it out. We talked about the balance schedule. It's important that kids have scheduled relaxation time just as much as they have scheduled activities and school time. And again, too much unstructured time, right, may not be the best either. So you might want to have an activity in there for them to do after school. It doesn't necessarily have to be educational, but just something that they enjoy, having some structured time. Modeling behavior, approach behavior, self-care, and positive thinking. As caregivers, it's easy to be overwhelmed. We have a lot going on with ourselves, let alone taking care of our kids. And so how can we model behavior that shows when we're anxious or nervous about something, we're not going to shy away from it, right? We're going to figure out a plan we're going to approach. And when we do feel overwhelmed or we feel we're just not at our best, what can we do? What is self-care, right? What are some of our strategies that we use to calm ourselves down, to make us feel good? And when our kids seeing us do that, it's likely that they will do that as well. It's important to encourage sleep hygiene as well as healthy eating. A lot of time this just goes kind of missed where our kids aren't sleeping well. Oftentimes kids with anxiety don't get enough sleep. They're either up, they have disrupted sleep, they wake up throughout the night, or they have difficulties falling asleep. So it takes them a really long time to fall asleep. It's important that we get the sleep schedule to a good place, as well as having healthy eating, having 3 meals throughout the day and snacks, and focusing on nutrition and exercise. Here we want to make sure we're creating a safe environment so that our kids feel like they can express when they're nervous. Getting your emotions validated. It's very likely the kids are going to continue to share emotions, right? But if we're dismissive, and this might be not intentional, but if we're dismissive and really just downplay everything, oh, you're fine, that's not a big deal, kids might be less likely that they're going to share things. And then for parents to manage over involvement, which can be a tough one, especially with some of our younger kids, is just knowing at what point can we give them more independence? How can we step back and let them solve certain problems without us jumping in? Because again, they need to fail at certain things to develop this sense of, oh, I can do hard things. I didn't get it this time, but I can figure it out, without us always jumping in to just kind of do it for them. And essentially encouraging them to face fears and minimize avoidance, right? So we don't want to shy away from things. So as a parent, like I just mentioned, helpful things that you can say when you notice your child feeling a little hesitant or feeling anxious about something. I know this feels scary for you, and those feelings are no fun. Right there, that one statement, you're validating. I know you're uncomfortable, right? I know this is scary and I've had those feelings. It's no fun, but it's okay. Remember that this is just your fear or anxiety talking. So you're helping them to understand that this is a part of them, right? But it's just the anxious part. And then I know that you can handle this. Really just saying to them, you got this. I know you can handle it. And then they start to internalize these things to be able to say it to themselves. The questions, you can talk through certain situations with them. Well, how did this work out before, right? Maybe they have an upcoming test or there was a social situation that made them feel anxious. How did it work out? What do you think might happen? How likely is it that will happen? If it does happen, how would you handle it? So what happens with anxiety is we have this, well, what if this happens? And that's where it stops. It's what if this happens and it's catastrophic. But if we actually take the time to think through, what if this happens? Oh, well, if that does happen, I'd probably do this. And if I can't do that, then maybe I'll do this. You feel more confident in being able to handle the what if. But our little worriers often, and not even just little adult worriers as well, will say, well, what if this happens? This is going to be terrible. And it stops there. It's just this idea that something bad's going to happen. and we won't be able to handle it. But 9 times out of 10, we can handle it. So these are good questions to ask your child just to talk through. And you're not telling them the answer and saying, like, you'll be fine, this will be fine, this worked out well before. You want to get them into the mode of talking it through and asking these questions. So again, it's really important to help increase resilience in kids. And I mentioned this self-efficacy several times. It's just confidence, right? How do we increase confidence in our kids? There are many ways to promote resilience here. Some of these here are kind of a repetitive, but really just teaching kids to identify emotions and regulate any strong feelings they're having. How we promote problem solving skills by talking through situations, asking questions, and helping them to think through in the moment. What happens when people are anxious? I mentioned before, if you think back to that brain, when the fight, flight, or freeze system is activated, the amygdala is activated, we're feeling nervous, it's hard to problem solve because we're just in that anxious state. So, how do we get to the point of helping our kids to regulate that emotion and then problem solve? Let's talk this through. Yeah, and so I mentioned mastery and failure experiences are important, encouraging independence, having routines and structure, and ultimately just how do we cultivate optimism in our youth? We're going to have challenges. Kids are going to have challenges, right? How do we push through and know that it'll be okay? Right now, it's kind of tough, but in the future, it will get better. So we don't want them to get stuck in that moment. All right. So here I'm just going to briefly go over self-care and strategies to increase mental wellness, essentially focusing on kind of caregivers, parents, adults. What can we do to take care of ourselves to make sure that we can take care of our children? I mentioned these before in our sessions. We'll talk a bit about ways to ground ourselves or reorient to the present. Essentially, grounding strategies allow you to stay in the present moment, similar to kind of like a mindfulness approach. And they're often very useful when we feel dysregulated, which I can say, being working with kids, being around kids, often we are in that dysregulated state, right? And so if there's something that kind of just gets us super anxious or just agitated, strong emotions, this is really a helpful approach to get you back into the present moment and to calm down that emotion. And so we use 5 senses. Essentially, it's a strategy where you focus on 5 things around you, 5 things that you can see around you, 4 things that you can touch. And so literally, I'm touching my desk. It's hard. It's room temperature. I'm touching the keyboard. I'm touching this bag, right? What are things you can touch or feel? 3 things that you can hear. So it's a little late here. I hear my voice. I can't really hear anybody else. I think they've left. I hear the buzzing from my computer. 2 things that you can smell. Are there any smells around you? Do you have food or candy near you? Things that you can really bring in a scent. And then something you can taste. So 5 senses, you go through your senses, and oftentimes that helps to calm down in the moment. We can breathe. There are many different strategies for breathing. Here is just kind of breathing in for 3, holding for 3 seconds, and then breathing out for 3. So it's our triangle, our breath triangle. You can use colors. So pick a color. My favorite color is purple. As you see, my purple blazer. I'm going to look around the room and anything that's purple. Is there anything that I can find that's purple? When you're utilizing these strategies, again, to do that, you need attention. All right. You're using a different part of your brain. And remember, I said in healthy individuals that the prefrontal cortex down regulates, right, the amygdala, the fight or flight sense. So if you're able to engage those, if you're able to engage in that way in terms of your attention and thinking through, then you can help yourself to calm that emotion down in the moment. There are many other things that you can do, but these are just a few. Visualization and guided imagery. These are really important and very easy to use. It's important you practice them like when you're not in an anxious state or a stress state. And then the more that you do practice, it comes more naturally to physically relax your body. But to really immerse yourself in visualization, you can use the senses to bring you to that place. So, as an example, my happy place for years had been Manuel Antonio Beach in Costa Rica, right? And so I'm going to close my eyes, do my slow breathing, and then picture myself in that place. Use my 5 senses. What are 5 things that I see when I'm at that beach? What are 4 things that I'm touching? I'm walking along the beach right now. I could feel the sand on my feet. I can hear the ocean waves. I could smell. I'm in this tropical environment. You're just talking yourself through it and you're visualizing yourself in that place. So if you're able to do that, Eventually, the more you practice it, in those moments when you're feeling really stressed or anxious, you can utilize this strategy to calm yourself down. This is fun because this is something that kids and adults can do. So you can do it together with your child before bed. It's a good way to kind of calm them down. You can do it when you're doing your not you, but when you're helping your child with homework and their emotions are getting high and we're frustrated. Just take a second, use one of our strategies. Maybe you can do visualization, picture a place you'd rather be instead of doing homework. And then once we've kind of brought down that emotion state, the level, then we can kind of get back to the homework. So again, these are strategies that we can both use, kids and adults. This slide here just highlights earlier last year, I think there was an NIH live stream, and essentially this acronym highlights ways that we can help manage stress and anxiety. I'm not going to go through all of them now, but essentially practicing gratitude. Yeah. Engaging in relaxation skills, exercising and getting your body moving, accepting feelings, right? Sometimes it can be hard to accept that in this moment, I'm not feeling great, right? I feel a little sad. I feel down. I'm feeling really frustrated. That's fine. Accept and acknowledge all feelings and then figure out how you're going to move through them. And then T is for tracking thoughts, right? And so this is really important, especially as part of that preventative CBT model. Oftentimes, individuals with high levels of anxiety or even depression, our thoughts aren't very helpful. So they can be pretty negative, they can be critical, they can be fear-based. So if you're able to identify when you're having unhelpful thoughts throughout the day, you can then practice and restructure them. So when you're working with your child, it could be, you're doing homework, you're on the way to a soccer practice, or, you're stressed about something family related, I don't know. In the moment, recognize when you're having unhelpful thoughts. So you might be thinking like, this is never going to get better. Oh, okay. In the moment, that is not helpful, right? Because that's going to it's going to enhance the stress you're feeling or the sadness, whatever you're feeling in that moment. And so if you're able to, yeah, that's that's an unhelpful thought, right? How can I think about this? In this moment, this is difficult, but it will get better. We'll get through this. This has happened before. So really just learning to track those thoughts and then engaging in how you might change them. These are affirmations that oftentimes we use with the kids, but especially helpful as parents, as teachers, as educators, just like in general, I think as humans, it's important to have affirmations that resonate with you. Affirmations are positive, motivating statements that can help you to kind of challenge and overcome negative or unhelpful thoughts, right? Self-sabotaging thoughts. So a good way to do this is take some time to journal and really just reflect on your thought processes. Even if you're just taking 2 or 3 minutes before bed, you have a pause in the day after you drop off the kids, do some journaling and jot down your thoughts and reflect on really your thoughts and what you spend most time thinking about, and then come up with an affirmation. It's really important that, as a parent, as a role model, as a caregiver, you're showing yourself all types of compassion rather than criticism. Be aware that we all kind of experience suffering. And think about how you would get through that. So suppose how would you tell a friend to manage some situation that they were having? Talk to yourself in the same way that you would talk to a friend, with that level of compassion. And so again, these are just sample affirmations that you can use that we found to be quite helpful. So I also just wanted to include these resources here. These are some book resources for kids who do have anxiety. There are workbooks that you can use with teenagers and then with older kids as well. There are books. This Outsmarting Worry book is really a good one for ASA 8 to 13-year-olds maybe. Very short chapters, but it highlights what's happening in the brain and the body when they're feeling anxious and gives little strategies. The Ron Repeat book, They're Helping Your Anxious Child, is for parents, but it really talks through the best strategies that you can use for working with your kids and when they are exhibiting anxiety.